mother is a photographer. She took these. She loves taking photos and loves telling stories. They are about HIV.
There have been so many sad stories. Even though I know they are real, I sometimes find it hard to believe.
For 40 years, there have been so many stories of loss and despair, of fear and stigma, of discrimination.
Some of these people look so sad.
But there was also hope.
Wow.
People changed laws through activism and political struggles, and there are so many scientific breakthroughs.
Do you believe we can end AIDS for children?
Today, AIDS care is not as costly or complex, but still challenging. Even with all the achievements, sometimes I look at the photo and think the world has forgotten that HIV pandemic continues.
There's still so much to do.
These photos tell stories of many people who no longer face death from AIDS. My mother's photos tell the stories of people who need a blueprint for change.
We need to remind the world of their promises and commitments.
And so many people have joined this fight against HIV and AIDS because the world's largest challenges need the world's largest team.
I like these photos. Wow.
We do not get to choose what we face in our lifetime, but we just get to choose how we respond. It's time to galvanize action, build on lessons learned, and realign programs to meet the ambitious targets agreed in the declaration. And we must now come together to commit to implement the blueprint of the Global Alliance over the next 9 years.
I believe we can do it. What should we hang here on this wall?
Well, today, at the launch of the Global Alliance, you will all decide together what hangs on the wall.
We need to believe that together we're going to end AIDS in children, once and for all.
Good evening, good afternoon, good morning, friends and colleagues. It's fantastic to join you virtually. I wish I was with you in person because the energy that we get from each other during the PATA summits is really vital to sustaining us, sustaining our determination to work together. My name is Shaffiq Essajee. I'm the Senior Advisor for HIV at UNICEF. And I'm going to speak to you today and offer some global perspectives and priorities on what we need to do to close the gaps for children living with HIV. It seems that everywhere you look today, you see the words equity when it comes to the global AIDS response. In fact, UNAIDS has made equity the central theme of the latest global AIDS strategy. So I thought we could start by talking a little bit about what equity actually means. Equity refers to a sense of fairness and justice and recognizes that health is a right, and to achieve that right for all, we must overcome the biases that have resulted in some populations being neglected. Now, I think children and adolescents living with HIV are perhaps some of the populations that have experienced the greatest inequity in the AIDS response. And the global numbers show it all. This is the treatment cascade among children and adolescents at the end of 2022. And as you can see, only 57% of children globally were receiving antiretroviral treatment. That's 20 percentage points less than adults. And if you look across the whole continuum from testing to treatment to viral suppression, you see the same inequity persisting where children are faring much worse than adult populations. In fact, if you were to look at deaths relative to the total population of people living with HIV, children contributes 13% of all deaths due to AIDS, despite representing only 4% of all people living with HIV. And when you look within the Africa continent, the inequity is perhaps even more marked. Now, I don't want to dwell on these images for too long because I know they'll be hard for you to read them. You will have the slides and can review these data later. But in each of these figures, we've got a comparison of Western Central Africa and Eastern and Southern Africa. So on the left, we're looking at HIV programs, and we're comparing the percentage of numbers of children living with HIV. We are looking at the percentage of infants who were born to pregnant women who received testing within 2 months of life. And we're looking at the percentage of pregnant women who were accessing treatment during pregnancy and breastfeeding. The little red box represents Eastern and Southern Africa, and the green box represents the data from Western Central Africa. So you can see that coverage of ART is much lower in both women and children in Western Central Africa. And when you look at testing, only 1 in 5 exposed infants get a test for HIV in Western Central, compared with 4 out of 5 kids in Eastern and Southern Africa. On the right-hand side, we're comparing the epidemics at the end of 2022. And what's interesting is that in Western Central Africa, even though the incidence is much lower, when you look at deaths, especially in the 0 to 14 age group, they're about the same. The total AIDS deaths in children 0 to 14 in Eastern and Southern Africa was 35,000. And in the same year, it was 34,000 in Western Central Africa. So this inequity is resulting in a shift in the epidemic with a greater importance from the countries of Western Central Africa compared to the countries of Eastern and Southern Africa. The new Global Alliance to End AIDS in Children brings us some hope to try to address this inequity. We've spoken about this in PATA before, and as you know, it's a global initiative that follows on from the global plan and the 3 frees that you knew about. It's a little bit different, though, to those other initiatives. And the reason why it's different is because this is a country-led, not a top-down initiative. So we're actually asking the countries to drive the work of the Alliance in country, and that is given prominence in the structures and in the systems that the Alliance is putting into place. The other thing that's important is that the Alliance focuses on 4 pillars that include pediatric testing and treatment. It includes PMTCT and prevention of HIV among pregnant and breastfeeding women. But it also includes addressing the structural barriers, gender equity, social and structural barriers that are hindering access. And finally, it's not focused on different populations. The idea is to have one objective, which is to end AIDS in children. So even though there are these different pillars, the way it's put together is to ensure that things are working in concert and that we have one focus to try to achieve an end to AIDS in children. This is what the structure of the Alliance looks like. And the thing that's important on this slide is that PATA is actually within each of these structures. PATA is a key member of the steering committee that provides worldwide leadership. PATA is represented in the global working groups that are thinking about some of the technical needs for countries. PATA is in the regional hubs, supporting WHO, UNAIDS, and UNICEF to provide technical assistance to countries and support countries in reporting. And PATA members are part of the teams in country that have been convened to lead and direct the response. So the Alliance is critical to our work within PATA. What progress have we seen? Detailed country action plans have been developed, and many of you have been involved with the development of these plans in your countries. We've also formed a number of the technical and regional groups that are necessary to support the work. And data snapshots have been updated for each of the countries so that you can see at a glance where countries are in their response. We've worked hard to ensure that the Global Fund and PEPFAR are including these action plans and the priorities of countries within their national plans. And we've worked to raise funds to identify advocacy champions, both within PATA and with other networks of frontline health workers and communities of people living with HIV, to advocate for and support the response in country. We've developed new guidance. There is emerging guidance on PrEP in pregnancy, a triple EMTCT guidance note, and a pediatric case finding guidance note, which will be coming out later this year. And most important of all, countries met in Tanzania in February of this year to sign the Dar es Salaam Declaration. Now, I don't want to dwell on this declaration for too long, but it's worth noting that these are the things that our governments have agreed to. There are 10 points. There's a link in this slide below that you can click on to see the full text of the declaration. But I want to emphasize that PATA was one of the signatories to this declaration, so we are front and center as part of the response. What does this actually mean for our work? Now, if you look at what the Global Alliance has defined, there are a number of different strategic priorities that are listed within the Global Alliance documents as things that are important for programs to focus on. And as I look at that list today, I think there are three critical priorities from among that list that are really important interventions for the PATA family to take on board. They address each of the three 95s, and in sequence, they are finding children through case finding and especially family index testing, linking children with HIV to care and treatment, and scaling up the use of dolutegravir in order to improve viral suppression rates. As I noted at the beginning, there are something like 700,000 unidentified kids, and we're not going to find those kids through early infant diagnosis. These are children that have missed EID. They're already much older, living with HIV. The first of these is finding children through case finding, especially family index testing. When I started off this presentation, I reminded you that there are 700,000 undiagnosed, unidentified children living with HIV. And really, we're not going to find those kids using infant diagnosis. They've already missed out on the opportunities for EID. So we have to get innovative and use other strategies to find these kids. And family-based index testing is a very promising strategy where we follow up the children of adults who are living with HIV and on treatment. Using these approaches, UNICEF and other partners have found a very high yield, something like 13 to 14% of children that get tested using the family index approach are actually found to be living with HIV. So I think this is a really important strategy and really a priority for us all to be focusing on. The second priority is related to the second 95, and this is linking children that we identify to care and treatment. This is, of course, essential to make sure that positive kids are getting the services that they need. And in many countries, there remains a gap between children that are identified as living with HIV and children who manage to get access to the treatment that they need. And finally, the third priority, I think, is to scale up dolutegravir among children to improve viral suppression rates. We've been doing a great job with dolutegravir rollout. As of 2023, CHAI reports that something like 60% of all children living with HIV globally are receiving dolutegravir-based therapy. That's fantastic progress. But again, when you compare it to adults, the number in adults is closer to 90%. So there's a large difference between dolutegravir access in adults versus dolutegravir access in children. And I think this really is a priority area for us. If we could improve the quality of treatment that kids are receiving, we would improve their lives, their health, and their virologic suppression rates. So if those are our priorities, what are the approaches that we as a PATA family can take to really implement these priorities? I think the first idea that I want to put to you is the PATA ripple effect. This idea that you have the skills and knowledge and you can become the hub within your local community of providers to really take that knowledge, take those skills and ripple them out to other sites around you. So use those skills and your knowledge to train and mentor other clinics and other clinicians so that they understand these priorities and can implement them in their programs. I think the second thing is to expand on the work that we're already doing around clinic community collaboration and just recognize that that's an incredibly powerful collaboration that supports us in our work. In many settings, without communities being engaged, children will not access testing and will not access treatment. So reaching out to communities and maintaining that collaboration with communities is really essential. And I think the last piece is to activate the scaling up of dolutegravir by using your local data to advocate for resources for children. You know how many kids are accessing dolutegravir in your clinics and in the clinics that you're mentoring and supporting. Use that information to go back to our partners in ministry and say, there's a problem here. Children are not accessing the best quality services that they could be. So I want to close by just taking a little quote from the Dar es Salaam Declaration that I think is important for us to bear in mind. What our ministers said when they got together in Tanzania earlier this year was that we request all stakeholders, including civil society, faith-based organizations, religious and community leaders, local implementers and partners to work with us and embrace this opportunity to save and change lives. Together, we can build a legacy that allows children living with HIV to reach their full potential. So I want to close with those notes and thank you very much for your attention. I know that you'll be working hard thinking about some of these approaches and strategies and how you can scale them up. And I think we have a critical opportunity ahead of us. The Alliance has really built a lot of momentum in the global community and gives us finally a voice at the global level to talk about children, to talk about the inequities that they face, and to show people that we know exactly what needs to be done as long as we're given the priorities and the political momentum to be able to see the job through. Thank you very much for your attention.